what's your take on this, sir? How, what I mean, government has been issued an advisory, but as a doctor, what do you think, and what is this something that public needs to be worried about?
So I would like to say that currently, if you look at the overall global scenario in this, there has been a lot of discussion about the HMPV virus, the human metapneumovirus. It's an old virus. It was first detected in 2001 or somewhere in Netherlands. Now, over the last 20 years, it has not evolved aggressively. Yes, it has got certain mortality rate, especially in children. Now, if you look at instances around the third wave of COVID, when Omicron was there, Spain had actually reported this. But it did not lead to something life-threatening. It did not become a global pandemic. How would I differentiate this from COVID? Now, being a part of the old COVID Genomic Surveillance Committee, when we were actually doing active surveillance of genomics of COVID, COVID is also an RNA virus. So there was a lot of things about its mutation changing its route. Now, even the forms of which it is changing could be something that was worrisome, and which is why genomic surveillance was being done regularly. So as a part of the global consortium, GSAID is already actively doing the monitoring of it world over. At this juncture, let's look back and say already Indian Institute of Science has taken a lead to look at the pandemic preparedness, which means they already have listed all of these pathogens, including the monkeypox, including the HMPV virus, which they wanted to actively monitor and surveillance to predict future pandemics, which is already an ongoing work that they're doing with the central government. With the central government, they're already doing that. In addition to this, I think there are companies that have already come out with the diagnostic kits. I think there are companies that are already in the pipeline for validation, which means hospitals will have access towards early detection, especially in children with pneumonias. So on the front of diagnostics, state government, Karnataka, India, we are all ready with the pandemic preparedness approach of a One Health mission. There is no vaccine available for this virus, but we need to remember that, look, if you have taken a flu shot, if you have taken the 3 boosters of COVID, you already have good immunity against your upper respiratory tract, and the December-January month will be a month for flus and cold. We will not be needing to hit a panic button and queue up in the hospital. We need to know that this is something that will be treated at home and not in the hospital. And this is not something that is going to be spread by me talking or breathing, like COVID. Like COVID, that paranoia was there, that closed room, it's going to spread. I'm sitting at this distance, it's going to spread by me talking or even breathing. This is not the case with this HMPV virus because it's a droplet infection. It's with cough. So yes, precautions need to be taken. If you are dealing with a person who's got a cough, chronic cough, who's dealing with it, who's coming up quickly with 3-4 days of acute cough, you will need to be worried about understanding and take precautions, which is very important. So it goes back to our old formula of wear a mask, maintain social distance, maintain hand hygiene, 3 old formulas. But other than that, again, this is specifically for children. Adults seem to be immune to it. This is not something that's going to explode like what it is. And I'll take you all back to, see, in December 2019, we got the first strain of the COVID virus. The first one was there. Then we got the Delta. Then we had the Omicron. So every December we've had one version coming up. Like an Apple iPhone new version being launched, or like a Samsung phone. Every time these viruses are coming up with this new version. And somehow the world and the WHO has emphasized on what is called the pandemic preparedness approach. And we are working closely with the WHO partners, with IISc on the 717 program, which is 7 days to detect, 1 day to notify, and 7 days to respond. And at the central level with ICMR, with other global consortiums also working together to understand how the world is connected, because I think it's a global village right now where we know that because of international connectivity, things can move very fast. So the information we have right now is that we cannot be hitting the panic button, cannot create, don't use the WhatsApp university to forward messages and create unnecessary panic about this. have specific knowledge about this virus to say it is not something like a COVID which is rapidly mutating, which is rapidly spreading to breath. It's not. Your general good immunity is good enough. Wear your mask in public places as much as possible. If you feel that there are people around you who are coughing, carry at least a mask with you. That would be the most simplest thing to do. And from a genomic surveillance point of view, I think it's time for Karnataka to take a proactive measure to start looking at surveillance again, and the pandemic preparedness teams to jump in and start looking at understanding that from December to March, if it's going to jump in percentages, we'll have to keep monitoring this very closely. But that's a job we are doing every year from 2020. From when the pandemic started globally, the pandemic preparedness approach has been there globally. And I think that's something that is a responsibility now of every state. It's not an option anymore.